Chromium as a micronutrient. Which form of chromium is the essential trace element? Chromium with a valency 3, 4, 5 or 6? The answer is chromium with valency 3. While chromium 4, 5 and 6 are carcinogenic and chromium 3 is the biologically active form. Which of the following is false? Chromium decreases insulin resistance. Chromium intervenes in the metabolism of carbohydrate, protein, fat and in the oxidative state. Chromium acts by increasing the number of insulin receptors, modifying the insulin receptor binding, increasing internalization of insulin and activating the translocations of the glucose transporters GLUT1 and GLUT4. The oral chromium adequate intake is 35 microgram per day and 25 microgram per day for young men and women respectively. So the answer, all the four statements are correct. Chromium is very important for reducing insulin resistance and adequate glucose utilization by the cells. The parenteral requirement is less than the oral requirement because here we are giving directly to the blood. The parenteral requirement is as low as 0.14 to 0.87 microgram per day. And those preparations which comes have usually 10 to 15 microgram per day of chromium. So this is how the blood sugar fluctuates in a diabetes mellitus patient. Blood sugar fluctuates like in diabetes mellitus in chromium deficiency. So the green curve shows there was no much glucose variations in the blood with adequate amount of blood chromium. When there is a chromium deficiency, the blood sugar fluctuates immediately after the meal. There is a high followed by a fall after a meal which causes craving and increased sugar intake. So this much variation in blood sugar levels occurs if there is chromium deficiency and this resembles that of diabetes mellitus.